shoulder flexion. What I am going to do is I am going to make sure that the arm is adducted to the body, and I am going to place my fingers on the clavicle and on the scapula, move them all the way down till I find the acromion process. Great. And I'm gonna move a little bit down till I find that dip right there, which is the top of her humerus. Great. So now what I am going to do is I'm going to get the goniometer. I'm going to place the fulcrum right where my finger is, right there on that dip. Okay. Great. And now I'm going to make sure that the stationary bar is on the humerus. I'm sorry, is parallel to the trunk of her body, and that the movable bar is parallel to the humerus of her arm. And what I'm going to do now is I am going to stabilize. I'm going to place, I have my 0 now, so what I'm going to do is I'm going to place my finger back in that spot right there, which is the top of the humeral head. I'm going to stabilize over the shoulder and on the trunk, and I'm going to ask her to please raise her hand as much as she can, as far up as she can. If you can please do that. Great. Awesome. That's great. Now what I'm going to do is I'm going to leave my finger in that same spot, get my goniometer, place the fulcrum of my goniometer where my finger is, leaving the stationary bar parallel to the trunk of her body. Beautiful. I'm going to get the movable bar and go ahead and move it parallel to her humerus. Great. And right there, you can relax your arm. And what I'm seeing is that she is within 0 to about 163, which the norm of this motion is 0 to 170. And this was done in a sagittal plane and frontal axis of rotation. I'm about to perform range of motion test with a goniometer for shoulder extension. What I am going to do is I am going to place my hand on her clavicle and place my other finger on my finger on her clavicle and my other finger on her scapula. I'm going to move them down to find the acromion process right there. And then I'm going to move down to find where there's a dip, which is the top of her humeral head. Then I'm going to get the goniometer. I'm going to place the stationary bar parallel to her trunk, and I'm going to place the movable bar parallel to her humerus, and the fulcrum will go right over where my finger is. So make sure that I am getting a 0 for my starting point. Perfect. Okay, I'm going to place my finger right back in that spot, which is the top of her humeral head. I'm going to place my hand over her shoulders and her trunk to ensure I am stabilizing her movement. And then if you can go ahead and move your arm as back as possible. Perfect. Just stay right there, please. I'm going to get the goniometer, place the fulcrum right there, ensuring that the stationary bar is parallel to her trunk, and I will go ahead and place the movable bar over the humerus of her arm. And you can go ahead and relax. I have my movement my numbers right now. So for shoulder extension, the range is 0 to 60, and what I have right now, is 40 degrees, 0 to 40, and that tells me that she has 0 to 40. And that movement was done in a sagittal plane and frontal axis of rotation. Right now, I am about to perform a range of motion test on the shoulder abduction. And what I am going to do is I am going to ensure that her arm is adducted to her body. I'm going to place my fingers on the clavicle and on the scapula, move them all the way down to find that acromion process, which is right there. I'm going to draw a little imaginary line to find the posterior side of her acromion process, and then I'm going to get the goniometer, make sure that my fulcrum is placed right there on the posterior side of her acromion process. My stationary bar is parallel to the trunk and the movable bar is parallel to the humerus. Then I'm going to place my finger right back over the posterior side of the acromion process. I'm going to stabilize at the shoulder and the trunk. And Megan, if you can please move your arm to the side and upward to the sky as far as you can. Beautiful, thank you. Then I will grab the goniometer and place my fulcrum right over where my finger is at. I will hold this, make sure that my stationary bar is parallel to the trunk of the body, and place the movable bar right there, parallel to the humerus. And what I am getting is, you can relax your arm, what I am getting is 0 to 170, which is the normal for this. This is the normal range, which is, the normal range is 0 to 170, and she has a range of 0 to 170. And this movement was done in a frontal plane and sagittal axis of rotation. Hi, right now I'm about to perform the range of motion test with a goniometer, and this will be on the internal rotation. So if I will place her arm and her elbow in a 90-degree, and I will be looking for her olecranon process, which is right here, and I will place my finger right there, and what I will be doing is stabilizing at the distal end of the humerus. I'm going to go ahead and grab my goniometer and place my fulcrum under the olecranon process, and I'm going to keep my stationary bar perpendicular to her trunk, and the movable bar will be right under the forearm, the ulnar side of her forearm. So you can just place it right here. Perfect. So I'm going to go ahead and place my finger right back on that olecranon process, and what I'm going to do now is I'm going to stabilize at the distal end of the humerus. And if you can just keep your hand open for me, fingers open, fingers there, thank you. And if you can just bring your hand inside towards your stomach as much as you can. Perfect, great. So I do not need to stabilize anymore. I'm going to get that goniometer. I'm going to put my stationary bar, I'm going to put my fulcrum under the olecranon process, and my stationary bar is going to be perpendicular to her trunk, and my movable bar is going to go underneath. It's going to go underneath the ulnar side of her forearm. Okay, great. I think I have my numbers there. This is good. And what the normal range is 0 to 60. And what I am seeing is that she has about 55. Yep, she has about 0 to 55 range of motion. And this movement was done in a horizontal plane with a vertical axis. I am performing a range of motion test with a goniometer for external rotation. What I am going to do is I am going to have her place her elbow in 90 degrees. Thank you very much. And what I am going to do is I am going to place my goniometer's fulcrum at the olecranon process. Okay, my fulcrum is right there where the olecranon process is, and my stationary bar is perpendicular to her trunk, and the movable bar is under the ulnar side is parallel to the ulnar side of her forearm. Okay, I'm going to place my finger right back there where the olecranon process is, and I'm going to stabilize at the distal end of the humerus, and I'm going to go ahead and ask you to please bring your arm out as much as possible. Great. Okay, I'm going to go ahead and place my fulcrum right where the olecranon process is. Okay. And I'm going to ensure that the stationary bar is perpendicular to the trunk, and the movable bar is parallel to her, there we go, is parallel to the ulnar side of her forearm. Okay, there we go. You can go ahead and relax. And what I see there is that she has 0 to 70 degree range of motion, where the norm is 0 to 80 degrees, and this was performed in a horizontal plane and a vertical axis. Right now, I am about to perform a range of motion test using a goniometer on the shoulder adduction. Okay, so the first thing that I will do is I will find her clavicle, and I will place my fingers on that clavicle and on her scapula, and I will move my fingers down to find the acromion process. Perfect, I have found the acromion process, yet I need to be on the superior aspect of the acromion process, so I'm gonna go ahead and move up. Yep, right there I feel the superior aspect of the acromion process, so that is my access point. What I'm gonna do is I'm gonna grab my goniometer, and I am going to place the fulcrum over my access point, and I will place a stationary bar towards the neck, and I will have her go ahead and lift her arm. Megan, if you can please lift your arm. Perfect. And there we go. And there I have my starting point, which is a 0. Great. I will remove my goniometer, and I will go ahead and place my finger right over the superior aspect of the acromion process. And if you can just move your arm right in front of you. I'm sorry, one moment. I will go ahead and stabilize first over the shoulder and the trunk, and go ahead and please move your arm in front of your body as far as you can. Great job, thank you very much. I'm gonna go ahead and get my goniometer and place the stationary bar, place my fulcrum over my access point with the stationary bar towards her neck, and move my movable bar over the towards the humerus, and there I will go ahead, and you can go ahead and relax and see what her degree is. And she is at 105. She's at 105, 0 to 105, and the normal range of motion for shoulder adduction is 0 to 130. So Megan gave me 105, and with this movement was done in horizontal plane and vertical axis. I will be performing a range of motion test on the horizontal abduction. What I will be doing is I will be finding the acromion process by placing my fingers on the scapula and the clavicle, moving them down to find the acromion process. Great. And I need to be on the superior aspect of the acromion process. So I'm gonna go ahead and just place my finger right there. That's great. And so I'm going to place my first, Megan, if you can just bring your arm out. Yeah, right there, perfect. Just please stay right there, because I'm going to place my fulcrum over the superior aspect of the cranium process, I'm gonna place my stationary bar right towards her neck. Okay, right there. All right, I'm sorry.
You're fine.
And I'm going to make sure that the movable bar is right there. And this is giving me a starting point of 0. I'm gonna go ahead and place my finger right back over that superior aspect of the superior aspect. All right, and I'm going to stabilize at the top of her shoulder. And I'm going to ask you to please bring your hand as back as much as possible. Okay, thank you. All right, perfect. And I'm gonna go ahead and grab the goniometer, place the stationary bar towards her neck, place the fulcrum right over my finger. All right, and I am, okay, perfect. So I have, I'm sorry. I'm just gonna fix that. My stationary bar needs to be right over my finger. All right, and then my movable bar is gonna go ahead and just be there. Perfect, and you can go ahead and relax. And what that tells me is that she has 0 to 21 degrees, and the normal range of motion for this is 0 to 40. 0 to 40, and this movement was done on a horizontal plane and vertical axis. Right now I am performing a range of motion test using a goniometer for elbow extension, elbow flexion. I'm going to ask Megan to please touch her shoulder. Great, and what I'm doing that so that I can find the lateral epicondyle. Right there, perfect. You can go ahead and place your hand down. Great, I'm going to place my finger right there, and I am going to go ahead and place the fulcrum of my goniometer right over where my finger is. Okay, and the stationary bar is parallel to the humerus, and my movable bar is parallel to the forearm, and I get my 0 point starting point. I'm gonna go ahead and place my finger again over the lateral epicondyle, and I'm going to ask Megan to please touch, before you do that, I'm going to stabilize over the, I'm going to stabilize over the distal end of the humerus, and if you can go ahead and touch your shoulder. Thank you very much. And I will go ahead and get my goniometer, place the fulcrum over the lateral epicondyle, ensuring that my stationary bar is over the humerus, is parallel to the humerus, and then I can go ahead and place my movable bar over the forearm or parallel to the forearm. Okay, thank you very much. You can relax. And what I see there is that we have, that we have 135 range of motion, 0 to 135 range of motion, and the normal range for this movement is 0 to 135 to 150. And thank you, Megan, so much. This was done in a sagittal plane and a frontal axis. Now I am going to perform range of motion for pronation. And so what I am going to do is I'm going to have her arm adducted to her body. Her elbow is going to be in 90 degrees and her hand is going to be in neutral. Could you please place your hand into a fist position? And I'm just going to sneak this pen right in there. Just hold on to that. Okay, perfect. So what I'm going to do is I'm going to look for the third metacarpal, which is right here, and I'm going to just keep my finger right there, and then I'm going to grab my goniometer, and I am going to place my fulcrum right over that third metacarpal, and I am going to go and place my starting position in 0, my stationary arm is going to be perpendicular to the floor, and my movable arm is going to be parallel to the pen. So I have that starting position. Great. And now I'm going to go ahead and place my finger right there again. And I am going to ask you to please I'm going to stabilize first at the distal end of the humerus, and then I'm going to ask you to please turn your hand facing down. And yep, just like that. Perfect. Great. Thank you very much. And then what I'm going to do is I'm going to grab my goniometer, and I'm going to place the fulcrum over that third metacarpal, just like so. And then I am going to get the movable arm and place it perpendicular to the pen, and there we are. And I'm going to go ahead and get my measurements, and you can just relax. And so what that tells me is that she has about 89 degrees when the norm is 0 to 80 to 90, and that was done in a horizontal plane with a vertical axis. Right now what I am going to perform is supination, range of motion. What I am going to do is I am going to have her arm adducted to her body. I'm going to place her elbow at 90 degrees and have her wrist in neutral, and then I'm going to have her close her hand into a fist and hold on to this pen. I'm going to look for her third metacarpal, place my finger right there so that I can get my fulcrum and place it right over the third metacarpal. Then I'm going to leave the stationary bar perpendicular to the floor, and I am going to have the movable bar parallel to the pen so that I can have a starting point of 0. Then I'm going to go ahead and place my finger right over that third metacarpal and have Megan before I go ahead and do that, I'm going to stabilize right here at the distal end of the humerus. And now Megan, if you can please turn your hand facing the fist facing the ceiling of the ceiling. You can just go ahead and make that movement. Perfect. If you can just leave it right there, then I'm gonna go ahead and get the goniometer and place the fulcrum right there, and great. And then I'm going to get my movable bar just like that, and then you can go ahead and relax. And what I have there is 0 to 90 when the norm is 0 to 80 out of 80 to 90, and that was done in a horizontal plane with a vertical axis. What I am about to perform is range of motion for flexion of the wrist, and what I am going to do is I am going to ensure that we have a neutral wrist. I'm going to find the second metacarpal and go down to find that snuff box, and then I will continue to go down to find that radial styloid. I am going to have your hands just be right here. Thank you. I'm going to place I'm going to place the fulcrum right over the radial styloid, and ensure that my stationary bar is over the forearm. And then I am going to place my movable bar over the second metacarpal. Let's just get a good, have a good starting point of 0. Great. So I'm just going to go ahead and place my finger right over the radial styloid, and what I'm going to do now is I'm going to stabilize at the radius. And then what I am going to do is ask Megan to please move her hand towards her body as much as possible. Thank you very much. And then what I am going to do is I'm going to place the fulcrum right over that radial styloid with my stationary bar right over the radius, and I am going to move my movable bar to that second metacarpal. Okay, that's right about there. And then I'm going to go ahead and look at my measurement. You can relax, and what I'm seeing is that I have 0 to 60, and what that tells me is that she has 0 to 60 range of motion, and the norms for this is 0 to 80, and she did this in a sagittal plane and a frontal axis. Right now I'm about to perform extension of the wrist range of motion test using a goniometer, and what I am going to do is I am going to go down the second metacarpal to find that snuff box right there, and then I'm going to find right there is that radiostyloid. I'm going to place the fulcrum right over that radiostyloid right there. Oh, I'm sorry, gotta change that because I need my, okay, so my fulcrum is gonna go right over the the radiostyloid. I have my stationary bar right over the radius, and then I'm going to place my movable bar right over that second metacarpal. And great, I have a 0 starting point. I'm gonna place my finger right there over the radiostyloid, and what I am gonna do now is I'm going to stabilize at the forearm and ask Megan to please bring her hand as back as possible as she can. Beautiful. Okay, great. So now what I'm going to do is I'm going to get the goniometer and I am going to place the fulcrum over the radiostyloid, and I'm going to place that right there over the radius again, and I'm going to move this movable bar towards the second metacarpal. Great. And what that tells me, I'm gonna go ahead and see what her range is, and what she has is 0 to 50 range of motion, and the normal range of motion for this is 0 to 70, and that movement was done in a sagittal plane and frontal axis of rotation. Right now I am performing a range of motion test for ulnar deviation. So what I am going to do first is I am going to place the forearm right there, and I am going to have the palm of her hand facing down in pronation. I am going to look for that third metacarpal and go all the way down to find that capitate bone right there. And what I'm going to do is I'm going to get the goniometer and I'm going to place the fulcrum right over the capitate bone right there. I'm going to have the stationary bar right here over the forearm, and I'm going to have the movable bar right here over the third metacarpal. I am starting at a 0 point. Great, so I'm going to place my finger right back over the capitate bone. I am going to stabilize at the forearm, and I am going to have you please move that pinky towards your arm as much as you can. Great. If you can just stay right there, that would be awesome. I'm gonna go ahead and get the goniometer and place the fulcrum right over that capitate bone with the stationary bar over the forearm. And then I'm going to get the movable arm and place it over the third metacarpal. Right there. I'm going to go ahead, you can relax your hands. I'm going to look at my numbers, and what I can see is that she is at a 0 to 31 degrees, and what the norm for this is 0 to 30. And what that means is that she did this movement in a frontal plane and a sagittal axis. Right now I'm about to perform a range of motion test with my goniometer on the radial deviation, and what I am going to do is I am going to place her arm and the palm of her hand pronated, so it will be facing the table. I am going to look for her third metacarpal and go down that metacarpal to find that capitate bone right there. Great, and I am going to get my goniometer and I'm going to place the fulcrum right over that capitate bone. Great. I'm going to I'm going to place my finger right over that capitate bone again so that my stationary bar is over her forearm. So I'm going to place the fulcrum right over the capitate bone, and I am going to place that movable bar right over the third metacarpal. Perfect. So now that I am starting in a zero starting point, I'm going to place my finger right over that capitate bone again. I'm going to stabilize over the forearm, and then I'm going to ask her to please move the thumb. If you can just please move the thumb towards your hand, towards your left as much as possible. If you can just leave it right there, please. And then I'm going to grab the goniometer. I'm going to place the fulcrum over the capitate bone again, placing the stationary bar over the forearm, and then I'm going to get that movable bar and place it over the third metacarpal. Great. And I'm going to see my measurement, and what I see is that she has 21 degrees, and no, she has 20 degrees, and this 0 to 20 degrees, and this range of motion is, the norm is 0 to 20 degrees, and she performed this movement in a frontal plane and a sagittal axis of rotation. Right now I am about to perform range of motion on the MCP flexion. What I am going to do is I am going to place the hand in the wrist in neutral, and I am going to get the goniometer and look for her second metacarpal, and I am going to get the fulcrum of the goniometer and place it over the second metacarpal. Okay, and I'm going to ask you to please just go ahead and place your finger extended. Perfect. And I get a starting point of 0, which is great. Now I'm going to leave my goniometer here, and what I'm going to do is I am going to stabilize at the proximal end of the metacarpal, and I'm going to get my goniometer and I'm going to place it over the second metacarpal. Okay, first I would like for you to please just move your fingers down towards you. Perfect. Great. And you can just go ahead and leave that there. Okay, and I am going to place my goniometer's fulcrum right over the second metacarpal. Okay, just like so. And I'm going to move my movable arm all the way down. There we go. All right, and you can go ahead and relax. And what I'm seeing here is that she is from 0 to 84 range of motion, and for this movement we have a normal range of 0 to 90, and she did this movement in a sagittal plane and frontal axis. Right now I am performing a range of motion on the PIP flexion. I am going to go ahead and place the fulcrum of my goniometer right over the PIP joint. My stationary bar is parallel to the proximal phalanx, and my movable bar is parallel to my middle phalanx, and I'm going to go ahead and remove my goniometer. I am going to stabilize at the MCP joint, and I'm going to ask you to please bend your finger, perfect, as much as possible. Great. And then I am going to go ahead and place the goniometer fulcrum right over the PIP, and then I will go ahead and move my movable bar. Okay, there we go. And you can go ahead and relax your hand, and what that tells me is that she has a range of motion of 0 to 100, and the normal range of motion is 0 to 110. And this movement was done in a sagittal plane and a sagittal plane and frontal axis. Right now I am about to perform range of motion on the DIP flexion. I'm going to go ahead and get my goniometer and place my fulcrum on the DIP joint. I'm going to place my stationary bar. I'm going to place my stationary bar at the proximal phalanx, and I'm going to get my movable bar and place it on the distal phalanx. I am gonna go ahead and I have my zero starting point. I'm gonna move now my goniometer and stabilize at the DIP, and then I'm going to stabilize at the PIP. Okay, PIP. Here we go. And then I'm going to ask you to please move your finger. Yeah, just like that. Perfect. Okay, and if you can just leave it there. Perfect. I am going to place my goniometer's stationary bar right there, and I'm going to move the movable bar as far as I can. Okay, and now I'm going to see that the number that I have here, my measurement is 0 to 22, and the norm for this range of motion is 0 to 80, and she did this motion in a sagittal plane and a frontal axis.